I'm Stephen Meneses. I'd like to welcome Debbie Boothe Schmidt, Democratic candidate for House District 32.
Hi, Stephen. How are you today?
Just fine. Tell us about your positions and your experience that would encourage a senior or person with disabilities to vote for you.
I help take care of my mother-in-law. She's 83 years old, and she's living independently in a community that she's very happy in and has lots of friends. I would do anything I could to make sure that she is able to stay living independently. The idea of giving people the resources that they need to live on their own and be independent is something that I believe in for all seniors and people with disabilities. Unfortunately, the population needing care is growing at a rate faster than what there are care providers. When I'm in Salem, I want to work with our stakeholders, with folks like you, and find a way to support our care providers and their clients.
Thank you. Oregon Project Independence is a cost-effective program that keeps seniors and people with disabilities in their own home, and yet every year proposed funding for OPI is significantly cut. If elected, what will you do to protect funding for OPI?
I strongly agree that we must allow everyone to make the decisions that they know are best for themselves, and then provide the tools that they need to be independent. From what I know, aging in place is the best option for people that don't need intensive medical care. I see how these services continue to help give dignity to those who can't fully take care of themselves, but that don't need the 24-hour medical services. Knowing that the state is going to face tough budget decisions in 2021, I want to be in Salem. I want to be an ally in fighting and protecting the funding for OPI.
How would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an increasing senior and people with disabilities population?
With the budget shortfall the state will be facing because of the impact of the pandemic, we should prioritize not cutting services that receive federal matching funds. Because if we reduce $100 million of state funds, we could be losing hundreds of millions of dollars from federal government. We should not be leaving any money on the table, and we should be maximizing the use of our federal funds. When I get to Salem, my top priority is ensuring that our most marginalized communities are getting the services that they need. From our schools to our social services, I will advocate for the funding that does not get cut.
During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face the lack of accessible and affordable housing and receive appropriate nutrition?
We need to continue to help our lower income residents with their housing, or we will have more homeless. And in the long run, that's going to cost the state more. Again, looking forward to the budget situation we will be facing in 2021, I will absolutely fight to protect the funding that goes towards our critical social services. Clatsop County has the highest rate of homelessness per capita in the state, yet nearly all of the state funding to address homelessness has been going to Portland, not to our rural counties. There needs to be legislation that ensures that the communities are also getting the funding that they need. We also need to continue to provide food stamps and nutritional services to our elderly and people with disabilities.
What are your plans to improve the health of vulnerable seniors and people with disabilities, including people of color, who traditionally suffer from more health disparities due to pre-existing conditions?
For starters, I believe that we need to protect the progress we have made in services for our vulnerable seniors, people with disabilities, and BIPOC. We also need to assess what these communities need. We need to make culturally responsive effort by talking to our BIPOC communities and centering them in our policies. My current understanding is these communities have fallen through the cracks and have not received the support that they need. The systematic way that BIPOC have lacked access to healthcare and nutritional resources have set them up to have these negative health outcomes. So we need to look upstream to how we can prevent these issues. Through this, though this is vital, that I work with our seniors, our people with disabilities, and BIPOC, and advisory organizations like yours, and not just assume I know what they need. I need to go out and talk with them, see what they really need, and then lead and have them help us lead the policy decisions.
Thank you for your very candid and thoughtful responses, Debbie.
You're welcome, Steve, anytime.
Once again, this is Debbie Boothe Schmidt, Democratic nominee for House District 32.